Now, all this week on Five Live, we've been looking at the impact of the COVID-19 pandemic 5 years on from the beginning of the first lockdown. Today, we're focusing on long COVID and its impact. Before we come on air, I spoke to Rachel. She is a clinical genetics consultant with 15 years experience. But for the last 3 years, after several bouts of COVID, she's been struggling with long COVID. It's put her career and her life on hold. And as you're about to hear, when I spoke to her earlier, she explained that today was a particularly significant and sad day for her.
It's interesting this is today because I just had my forms arrived this morning for applying for ill health retirement, which after more than 15 years of training is not something that I ever wanted to think about doing. All this time I've been, I will try anything. If somebody suggested, dancing naked in moonlight would help me get better, I would do it. I've tried everything that anyone has ever said. And I just don't seem to be getting really any better. Generally, I wake up, I lie in bed for a few hours. I might manage to go and wash half of myself. I come back to bed and rest. And then I might be able to go and wash the rest of myself and put some clothes on. I might not. And food is hard because I often don't remember to eat, or I'll sit there hungry and not really have the energy to go and do anything about it. Or I might go downstairs and open the fridge and look in it and then close it and go away again. Or I eat cereal bars in bed, and I can just about go downstairs and put the kettle on and sit on the floor in the kitchen while it boils and make coffee and come back to bed. And then it's very boring and very frustrating. So it's not easy being a busy person trapped in a body that doesn't really move.
Rachel, what do you think the future holds for you? What are your hopes? I guess against what you know as a clinician is the reality. That must be quite difficult living in between those two worlds.
It is, and there just doesn't seem to be very much research going on. You hear about, little trials here and little trials there, and they've all got 50 or 100 people in them, and lots of them seem to be about how to rest better or how to adjust to being ill. And there doesn't seem to be very much by way of proper good going medical research going on. And I'm hoping you'll have some of the speakers that will contradict that. But I looked up at the weekend, and according to the NIHR, which is the UK's main funding body, there's been £50 million spent on research in long COVID since 2020, which, given it was last estimated to affect 2 million people, works out as £5 per person per year, per person with long COVID, or £20 per person per year for the 500,000 of us who are most severely affected. And if you compare that to, say, cancer research, which is obviously very important, and I wouldn't want people not to fund cancer research, that's £1 billion a year. And we've had £50 million in 5 years, and it's just not enough. So I just want to get better. I want my life back. I want to be able to go to the playground with my children. Really want my job back that I spent so long learning how to do. And for that to happen, we're going to need some treatment, because rest is not cutting it for me or many of the other doctors I know with long COVID. And there just doesn't seem to be any treatment trials going on, really. And there are so many of us who are so very, very desperate to get better. I know so many doctors in a long COVID group, and we just all just want to get better and go back to work. The biggest group of people affected by long COVID are working age women. And working age women also form the majority of the healthcare workforce and the social care workforce. And I read a study, or at least I read bits of a study. My concentration is not good enough to read papers really anymore. But I read the headlines of a study saying that scientists at UCL had worked out that long COVID costs £6 billion a year to the UK in lost working days. And this is people who want to go to work, who can't go to work, and we're sitting around actively costing the economy money. But on the other side of that, nobody seems to be putting any money into making us better. And I can't make that make sense in my head. I mean,
Rachel, your message then to government, if you had a government minister listening into this conversation now, what would you say?
I'd say, please, can you put some money into helping to treat us? Because my life, I mean, it's just a horrible husk of my former life. I'm having counselling for acceptance of how things are different now. And obviously that's useful because it's pretty miserable, but I don't want to accept it. I want to get better. And there are so many of us, and that's all we want. And the other thing I would say is, could people please believe us instead of gaslighting us? People do well when they can. And it seems like everybody always starts with the baseline of, you're making this up. You just don't want to work. It's like, why would I have given up a job as a consultant that I trained for many, many years to do, to live on £132 a week of benefits? That it's nothing. It's not right. And we don't want to sit around on benefits. But on the other hand, we need some. So I worked out what I get covers about a third of my monthly living costs. And I don't know what's going to happen when I run out of savings. This is why I'm applying for the ill health retirement. If I'd have died during COVID, my family would have been a lot better off. Financially, not emotionally. And this is no state to leave people. And then everybody's in power seems to be saying, well, you just don't want to work. You just need to try harder. And we don't believe you. And I think my tip to anybody listening is, don't ever get a new condition that primarily affects working age women, because nobody wants to believe you.
Rachel, who suffers from long COVID. Listening to that is Professor Rachel Evans, who is a Professor of Respiratory Medicine at Leicester University, as she also runs a long COVID clinic. Welcome to the programme.
Hello, and thanks ever so much for the invitation.
Well, it's good to have you. I know you run, one of the biggest long COVID clinic in the country, if not the world. Just your reaction briefly to what you heard Rachel say there. Getting people to believe her and getting the support that she needs. She's found it an uphill struggle. Does that resonate with you?
Absolutely, and it's heart-rendering to hear, isn't it, when somebody is having such a difficult time and then having to face some disbelief in the public. And Rachel has said so many really salient things there so eloquently, which really sadly is echoed by the over 8,000 people that we've seen in our local service. So some of the key points there about people wanting to get better, desperate for treatments, desperate to return to their lives. What Rachel was saying there, we often hear people say, I simply don't feel like myself. I think she brought some brilliant figures in comparison, which are very sad as well, around research being underfunded. There are still clinicians and scientists across the country desperately trying to research this condition, but we also need more funding to help run those all-important clinical trials.
Yes, and you're running one, aren't you, at the moment? Excuse me interrupting.
Right.
A trial around anti-inflammatories. So tell us about that.
That's right. So in our early data from one of the studies funded from that pool of money, we showed that there was definite evidence of underpinning biology that was causing long COVID. It is very complicated, but we showed that there were these inflammatory proteins that were higher, and we're doing a clinical trial targeting one of those proteins at the moment. We're about halfway through and we'll get the results next year. But we need many many more of that type of trial to really get people like Rachel the treatments to get them back to, feeling much better, to their normal lives. And as Rachel said, also it's really good for the economy. So it absolutely makes sense for everybody, patients, the healthcare system, and our overall economy to really pay attention to this very, very common condition.
Yeah, so I understand there's no biomarker to say that somebody has long COVID. So explain to us what that is and why we really need it.
Yeah, so long COVID at the moment is diagnosed by clinicians really on the history, i.e. the presentation and the symptoms of an individual. What would be helpful, and I would say we're good now at diagnosing long COVID, and patients are very good at diagnosing themselves. We obviously make sure there are no other underlying conditions driving some of those symptoms. But what we really need is what you were calling biomarkers, but targets that tell us exactly what is happening within that individual patient causing the problem, and then we can target the medicine to that target to have a real chance of helping them get better.
And your message then, I mean, there's lots of people getting in touch with us saying thank you so much for covering this on 5 Live today. For people who are struggling, I mean, you've got this incredible clinic in Leicester. If people are struggling to get the support that they need, what would your advice be?
Yeah, so there are other clinics, not just mine or ours at Leicester hospitals. There are other clinics still available across the country. We need more of them. And do speak to your local doctors to find where your local clinic is. And we obviously also are campaigning to the health system to really get more of those clinics so that they're equitable across the country.
Thank you so much for joining us. Professor Rachel Evans there, Professor of Respiratory Medicine at Leicester University. She runs a long COVID clinic there. Lots of you getting in touch